My name is Shaun Linton. I am the owner and director of My Place Childcare and School Age Center. We are licensed to serve 212 children on a regular basis. When the pandemic occurred, our enrollment basically dropped to about a quarter of that. Ohio has reopened technically. We are up to being able to provide care for approximately 100 children, and on a daily basis, we're still only seeing about 50 to 60 children. One of the big frustrations that we do deal with and have dealt with throughout this entire pandemic are the ever-changing guidelines, recommendations, all those kinds of things. The amount of information that came out on a daily basis was just overwhelming for everybody. It was hard to keep up with the changes that were going on day to day. The divider walls was one of the big things. We want to keep smaller group sizes in the classroom. So in all intents and purposes, they kind of split the room. Ultimately, I ended up deciding to go with a more temporary divider, which is made out of PVC, drop cloths, and a plastic sheet, basically, to prevent communication of the disease from classroom to classroom, or one half of the classroom to the other half of the classroom, because that's what I could budget for. In the back of my head, I'm also thinking, I've got to save back a bunch of money possibly to upgrade our divider walls or do whatever the fire inspector comes in and says. Our population of children that we serve here are pretty low income in our area. Early childhood centers cannot survive on the rates that were being provided right now. But our reimbursement rates, again, they're lower because we can't provide care for as many children as we used to in the past. In response to people that say we're lucky because we survived the pandemic, I would say it took a lot of hard work and planning before the pandemic occurred that allowed us to work through the pandemic. We've implemented a lot of new policies, spent a lot of money to get there. I had to do a lot of fighting to keep those staff here and working with the children while they are worried about taking things home to their family, while they're worried about some family bringing COVID into the center. Lucky that we stayed open. I'm glad that we were able to take care of the children that we were during that time, but luck had nothing to do with it. We've survived the pandemic so far after looking at how we are reimbursed and the amount of staff that we need here and the new cleaning regimen that we've implemented. We're probably going to be looking at about a $10,000 to $15,000 loss each month, even with the grant programs that the state came out with. After a month or two, those kinds of losses, you really look at closing your doors on a permanent basis. I think it's really important that the federal government would pass some kind of regulation to help supplement that loss.
Can you put your water squeeze, Jeff? Picture the water squeeze, Jeff.
Sorry, intercom system in the building. In my situation, we provide care for about 90% publicly funded childcare. I think we need to be paid more on enrollment instead of attendance. Looking at those funding sources and things like that, I think is really what needs to happen.
Childcare is essential for many American families to be able to return to work, but nearly half of childcare providers have completely closed their facilities, and many may not ever reopen. Closures of childcare providers means more demand for the providers that do reopen and fewer spots for children. In addition, necessary enhanced health and safety measures due to COVID-19 could lead to providers serving fewer children. An overwhelming majority of Americans support providing targeted financial assistance to the childcare industry. Initial efforts to bolster the childcare industry are a start, but funds are already running out or didn't reach the entire industry. Let's ensure that providers are there so that families are able to get back to work when it is safe to do so. Congress must act to ensure that childcare has the robust, dedicated relief it needs. Visit childcareaware.org to learn more about how to advocate for childcare. It's as simple as this: no childcare, no recovery.